Thank you. Assemblymember Rodriguez.
Yeah, just more of a comment. I want to thank the member for bringing this forward as well. It's well-intentioned. I know where you're going with it, but I know we had a brief discussion earlier, and because of that, I won't be able to support your measure at this time, but maybe I can a different time. But as for now, I'll be staying off on it.
Assemblymember Thurmond.
Thank you, Mr. Chair. Thank you, Mr. Chu, for getting us all huddled here under the tent. All these titans that Mr. Wood talked about, labor and pharma, and thank you for providing me with what you know I love more than anything from our time together in Sub 1, a 4-hour committee conversation. Thank you very much.
Just getting you back, brother.
But I do appreciate that you've raised the issue that we've been discussing in the Budget Subcommittee on Health and Human Services, and that conversation has largely talked about the rising costs of drugs, and in particular the $300 million that the governor had put in his budget to cover the hepatitis C drug. And I know people are talking about people poking people in the eye, and this is not about that. I lost both my parents to cancer. I want the innovation that everyone is talking about. But when I vote for this today, I want people to think about the people that we represent. Sick, elderly, people who need our help, who cannot get their minds around why a drug would cost $1,000 per pill. I don't know that there's any real way outside of the industry to really be able to get your arms around that. I know that I can't. And I thought that the pharma presentation was spectacular. Very well done. But at the end of the day, it is that issue that a drug could cost $1,000 per pill that drives public interest to say, what are we paying for? Why does it cost so much? And how do we get the cost down? So no matter what anyone thinks about this bill, it is probably one of the most meaningful conversations I think we've had in the Assembly so far this year, to really get to the heart about what is it that we're paying for, and how do we lower the costs of drugs so that we can care for those who need our help. What I appreciate about the bill is that it has provisions to address the concerns around proprietary protections. I am sensitive to the industry's concerns there, and I think that's very, very important. I think we should put a spotlight on the costs and to do so in a way that protects proprietary concerns. And I'd like to ask, one, that the industry work with the author on how to implement this in a way that those proprietary concerns are most fruitful. And I'd like to ask the author to just say a word about how the proprietary protections in his bill would work.
First of all, I want to just clarify, I am accepting the committee's amendments, and to Mr. Mainshine's points, there were concerns raised around not allowing the drug companies to capture the costs of failed trials or basic science research. We have amendments that would accept that. And there were certainly issues raised by the industry also around confidential and proprietary information. It was important for me that we accept that as well, because certainly I do not want to disrupt the amazing work, the stellar work that our drug industries do in really being on the forefront of saving lives, and that's important. But to your point, these are very difficult and important questions, and I want to thank colleagues. Are there other comments? I have some closing comments, but I want to save them for...
We still have additional members with questions.
Why don't we go to additional questions?
I'm going to work through the list. I'll come back to you, Assemblymember Burke, if that's okay. Assemblymember Chavez.
Well, I've been following this also with interest. Though no one visited me, but I don't take that offense.
I did try to set up a meeting with you about 6 weeks ago, but we'll talk about that later.
But I'm glad you're working with them. But I have a little perspective on it, maybe because I'm older. The life expectancy in the 60s for developing countries is about 65. Now it's about, 82 in developing countries. Varies by different regions. And to a very large degree, the reason our life expectancy has increased is because of the healthcare, medical care, in particular pharmaceuticals. I think the maker of the bill recognizes that the cost of pharmaceuticals has been relatively flat, around 10%. 9 to 11% over the past few years. Granted, healthcare costs have gone up, but the pharmaceuticals, at least in all the states I've seen, have been relatively flat. I'm seeing heads, no's, and head yeses. Maybe that shows the argument. But I'll just make these last couple of comments and close because I know it's getting late. The reality is that at one time, HIV was considered you were going to die. You were done. And that's no longer the case. People know that it's like you continue your life, and that's because of the breakthrough in technology. It was only a year ago that we're worried as a country about Ebola, and it was wiping out, it has wiped out thousands of people in Africa. But Ebola, now we have a vaccine. A lot of people may not know this, but the actual treatment for Ebola came out of the San Diego area and was released to the federal government and DOD without going through the FDA approval, which allowed a vaccine to save now thousands of lives, save a whole country, because of our ability in San Diego with the biocom industry to call everything together to solve that. That's a huge asset and capability. When you go down and you visit our biocom industries, diabetes and cancer will be solved in my lifetime. It's going to be solved in a few years, 5, 10 years. It's going to be done. And if you look at the innovation that's gone through, aspirin used to be like the miracle drug. I'm old enough to remember that, aspirin, the miracle drug. You know, vaccines are coming in, figuring out what you're going to do. You know, we had the big argument before about biosimilars. Now you have DNA therapy. You can go down to our companies right now, and this is very proprietary information, but they have rooms of computers that are sequencing DNA to see different different ailments and how to solve it and figuring out how to attack it from a DNA perspective. And I'm sure everybody's been following with interest this trip to Mars where we're going. We're actually using 3D printers with the ability to produce organs to replace your heart. They're saying within 10 years you'll be able to rebuild the heart, which is going to be the pharmaceuticals and drugs. It's just amazing to me. So this is a cost issue, and I agree with my colleague, Senator Wood, that, you know, this is a battle of giants. But up here we're looking at policy for the best health care. I would submit to you the reason we have people, regardless of their economic status, have the ability to have a longer lifespan is because of our investment in technology. And I would also state that the economic spinoff, there's no reason, there's one of the reasons Biocom's in San Diego is because of UC San Diego and the relationship between our universities and the industry, just like Silicon Valley with San Francisco, their relationship there. So it's not only a good thing for the health of the country, it's not only a good thing for new technology and jobs, it's not only a good thing for educating our young people for new sciences that we never even thought about. There's a huge advantage to this industry to do the right thing. And to say it was strictly transparency is not, I think, the total deal. I would agree that we do need to look at healthcare costs. I would agree, and I'd love to be on it, a select committee to actually look at this, but take it in its totality, because hospital costs are going up in the hospitals because of the new technologies, robotics, all this stuff going on in there. You know, there's so many things going on that are driving healthcare costs we need to look at. And to pick out one that's only 10% of the total cost of healthcare without looking at the whole 90%, to me, would be short-sighted. And I agree with my other statements that we need to look at it as a totality. So I won't be supporting this because I think you would see unintended consequences that may actually prevent us to figure out how to build that heart in 10 years, replace the organ, or actually to solve cancer within 5 years.
Assemblymember Waldron.
Thank you, Mr. Chair and committee. Assemblymember Chu, I really appreciate what you're trying to do, and I also appreciate the time we had talking about it, and my weekend and even last night trying to work on this, reading it and speaking this morning with you about it. So I did put in my time, and I appreciate that. And I think we can all agree that the healthcare costs are huge and rising. The new life-saving drugs that we're seeing now have put a more intense focus on the high costs of some of these new innovations. But the healthcare industry in general has so many moving parts. And this bill addresses one part, the pharmaceutical companies. So that's what I was struggling with. And, we talked about that. I looked at SB 746, which had been previously through this committee, I guess last year. Eventually, that bill required a similar sunshine on health insurance plans. So I found that interesting because that was one, and now we have one that's doing the same thing similar to pharmaceutical. SB 746 eventually did not become law. But as we heard today, it's very complex. We have the publicly traded companies versus the private, the negotiated pricing versus the retail pricing. There could be an impact or even a stifling on innovation, which, that's the last thing we want. But both sides have told me when I met with both sides of the argument multiple times, they already publicized their cost and their profit info. It's already out there. It's in different places, but it is out there. Another thing I struggled with, I'm a business owner, obviously at a smaller scale. I mean, when I look at how I price my product, I have to look at everything from what it costs for me to turn the lights on to my employee, to not only just the cost of the good, what goes into the product itself. But, your bill with the amendments would be what I would consider what we use for when we design the product and when we, all the setups and all the things that go into creating it. But we also have to include everything else, from the gas we have to put in the truck to take it down to pick up the items, and all of that is part of it. Free market principles cannot be ignored and may necessarily not be quantifiable. And I think that's another thing that we can't really grapple with within the context of this bill, because there's so much that can't really be quantified. But like I said, I do appreciate what you're trying to do. And I think the concept that you do have in the bill, the working group, is a good. It's been mentioned, a select committee. This is a huge issue. I think we all need to have everyone at the table and start to talk about it, because the issues are insurance industry, the innovations, government regulations. How much does that impact? The FDA and how slow they are a lot of times, all the issues with that. All of those things go into the cost. So at this time, I cannot support the bill. I definitely put my homework into it, and so I'll be voting no at this time.
Thank you, Ms. Waldron. I just want to respond to a couple of things. First of all, as someone who also ran a business for 9 years, I certainly appreciate all the challenges that any business has in needing to make sure you're recouping your costs and recouping your investments. The thing about this industry, as we know, is it is a little different from other industries. There is no other industry where you're providing the types of patent protections for potentially a long period of time, and there's no other industry where you have pricing that is so very different depending on where you are. And as I think folks know, we are the only industrialized country in the world that does not have drug pricing controls. And in our country, that has enormous ramifications. I also want to take a moment and respond to Mr. Chavez in his suggestion around all of the amazing benefits that we get. Absolutely true, but at the same time, we are seeing costs rise astronomically in ways that we've never seen before in this industry. And I want to just give an opportunity for Nick to lay out a couple of statistics in this area, because I think it's important for us to know exactly what these numbers look like.
Yeah, to your comment, Assemblymember Chavez, I think one of the pieces of misinformation that's getting out there is that drug prices are not on the rise. And obviously, as the payers in the healthcare system, we're very concerned about cost increases in the system. And we just say that the Assemblymember Chu mentioned this in his testimony. But if you look at the top 100 drugs by sales, in 2010, only 26% of those were $10,000 a year, or per patient, I should say. Pardon me. In 2014, that's increased to 47% of those top 100 drugs. So they are on the rise, and indeed, in those 4 years, that price increase in that category increased by 750%. So we are concerned about the trend. We are concerned about the pipeline. There are about 11 or 12 drugs that are going to be introduced or approved, I should say, by the FDA that are in the blockbuster category. And then based on actually an old analysis, this may be different now, the drugs are actually 14% of the premium dollar, not 10. I would, with your indulgence, Mr. Chair, I just would like to offer to come in and talk to Assemblymember Manshine and Assemblywoman Waldron about our position on SB 46. I think there's some misinformation that's being delivered on that bill. We oppose that bill because the information that was provided by the plans triggered a specific regulatory action on the plans. It wasn't a pure transparency bill from our perspective. We removed our opposition to a follow-up Leno bill when it was distilled down to a transparency bill between employer purchasers and labor trusts and the health plan. So I'd like to come in and talk to you more about that because I think that's a bit of a Jedi mind trick as part of this debate.
And if I may just respond, because you mentioned my name on that one, what I said was the percent of pharmaceuticals was relatively flat. I understand healthcare costs are going up, so is pharmaceutical costs going up. But as far as the percent of the total cost, it was within 2% over the past couple of years.
I like the San Diego solidarity. I think it was Assemblymember Manshine and Waldron that was mentioned. But thanks for stepping forward, Assemblymember Chavez. You don't need to respond if you don't like, but you have member privilege if you do like.
No, thank you. I was just going to, all I said was that the bill didn't become law. I didn't state how the plans opposed or not opposed or whatever on it, so I just had looked at it.
Assemblymember Burke.
First, I want to say thank you to Assemblymember Wood. I appreciate your comments, and I actually do echo them in the idea that this is such a huge issue, and I do believe that it does need more conversation by the Titans and all of us, and I want to thank the chair for letting us have that conversation. I'm going to echo also Assemblywoman Bonilla's sentiment that if I do in fact support it so that we can continue the conversation, it will be with maintaining the reservation of the possibility that I would not vote for it on the floor, because I do still maintain that I would like to see a tool, not just transparency. Thank you.
Are there comments or questions from committee members? Thank you for your comments and questions up to this point. Thank you for the robust discussion. At this point, we'll go to Assemblymember Chu. This is your opportunity to close.
Thank you, Mr. Chair. Thank you, colleagues, for grappling with what we know are big questions, what we know are difficult questions. And at the end of the day, what I am looking for is to get the right answers, not necessarily to jam something out. I want to thank many of you who have offered to move this out of committee so that we can continue to have more conversations. What I think I'd like to suggest, with the permission of the chair, is that we hold this for 1 week. Colleagues, you know, we've all been having a lot of different sidebar conversations. I would like in the next week, as you have focused on this, and this is something I've been thinking about for years, to provide me your best thoughts and how we move this forward. I also am happy to have another opportunity to work with the industry to see if there are ways for us to just better understand the information that we get. But that is what I would like to ask. And let me just close with the following, colleagues. Every one of us has a personal connection to these issues. I was trying to decide when I thought of my first freshman legislative package if this was a topic I wanted to take up. And I have been thinking about these issues literally for 20 years when I started working on HIV/AIDS issues in urban settings years ago. And we all have constituents who are priced out of the market. And I want to tell you that as I was trying to figure out what bills I wanted to move forward, I decided to, like all of us, visited a church on a Sunday, a church that had supported me in my last race, African American church. And I was asked to say a few words at the end of the sermon on what I was planning to do for my constituents. And there was a parishioner who got up when it came time to prayers. And she was in her 60s. She looked in the pink of health, and she said, Assemblymember Chu, I have hepatitis. There is a drug. It costs $1,000 a pill, and I can't afford it. And I need you to go to Sacramento to figure out how this cannot be, because if I don't get that pill, I'm going to die. And what I ask all of us colleagues, as we think about it, this is not just about one industry. This is not just about $300 million. This is fundamental to who we are as policymakers and what we do. And so I would ask you, if you can, to work with me in the coming days to see if we can move something forward, because this is important. And with that, colleagues, I very much thank you for your consideration and discussion.
Thank you, Assemblymember Chu. With that, we won't be taking this bill up for a vote today. We will look forward to coming back in a week to continue the discussion. Thank you.
Thanks.
Okay, as a courtesy to a witness who needs to leave shortly, we're going to take up file item 18, AB 1147, Assemblymember Mainshine. We'll be following that with Assemblymember Allen. Item number 26, AB 1425. This first one will be quick.
Thank you very much, Mr. Chairman and members. Thank you. Thank you.
We have a motion and a second.
In light of that, this bill would permit medically fragile adults to remain at their current facility in a separate transitional care unit after they turn 22 years of age until they reach a mental capacity of 18 years old. It's also revenue neutral. We have been working closely with the Department of Health Care Services and other stakeholders, and there is no known opposition to the bill. I respectfully request your aye vote.
Witnesses in support.
Peter Kellison on behalf of Together We Grow, the sponsor of the bill. We're in support of the bill. Terry Acho, the owner and operator of Together We Grow, is here for technical questions.
Okay. Does it require a higher vote? Additional witness in support?
Julianne Broyles here on behalf of the California Association of Joint Powers Authorities. We think that for our publicly run hospitals that this will help reduce medical errors and our liability through our risk pools. Ask for an aye vote.
Okay, we'll clarify. Additional witnesses in support.
Bernadette Ariano on behalf of the California Children's Hospital Association, in strong support.
Lydia Bourne, representing American Academy of Pediatrics, in support.
Stuart Thomas on behalf of California Medical Association. Apologies to the committee. We didn't get our letter in our time, but we are in support of the bill. Thank you.
You sure? Okay. Witnesses in opposition? Seeing none. Questions or comments from committee members? Seeing none. We have a motion. We have a second. The motion is due pass as amended to appropriations. Madam Secretary, please call the roll.
Bonta?
Aye.
Bonta, aye. Mainshine?
Aye.
Mainshine, aye. Bonilla? Burke? Burke, aye. Chavez? Chavez, aye. Chu? Gomez? Gomez, aye. Gonzalez? Hernandez? Lackey? Lackey, aye. Nazarian? Patterson? Patterson, aye. Ridley Thomas? Ridley Thomas, aye. Rodriguez? Santiago? Steinnorth? Steinnorth, aye. Thurmond?
Aye.
Thurmond, aye. Waldron? Waldron, aye. Wood? Wood, aye.
Bill passes 12-0. Next, we have item number 26, AB 1425. Assemblymember Allen.
You may proceed, Mr. Allen. Thank you for your patience.